Hi, ladies and gentlemen, it's Dr. Novoa. Just to follow up on the use of masks here in El Paso, and also I was asked to comment on Mr. Bob Moore of El Paso Matters. An article was printed from KDIH.com, and I was asked to comment on it. So, first of all, I do agree with some of the statistical analysis of Mr. Moore. I don't necessarily agree that the doubling time of the coronavirus is going to be every 3 days, more like 5 to 7 days. Nevertheless, in mid-May, we'll probably see 13,000 actually confirmed cases here in El Paso if we were to go with the doubling time theory. The problem is this: although we only have 78 confirmed cases here in El Paso, we are under testing because of the limited number of tests that we have in El Paso. We don't have the sufficient number of tests to test everyone that's showing symptoms of the particular condition, as well as the fact that many people that have symptoms are not able to go see a primary care doctor or don't want to go to the emergency room. So we're underreporting exactly how many people actually have coronavirus here in El Paso. But the health department has been documenting how many of the 78 are actually associated with community spread. So as I stated before, if you have community spread, that means that you don't know where the source of the original infection was for the person that came in with symptoms. As such, how many people have been affected by that particular virus to that person is dependent on the population density, as well as mass transit, as well as geographically. And if we were to look to a comparison to New York, once you have community spread in New York City, 100,000 people may have been exposed to that one person. Here in El Paso, even though we had 5 or more than 5 now of community spread, it may be more like 25,000. Nevertheless, if you're looking at an exponential increase in number of patients or people that are getting exposed to patient zero, as it were, or one of the sources of the community spread, you're going to see that probably by June, the vast majority of El Pasoans will have been exposed to coronavirus. That is the reason why I recommended more than 2 weeks ago that people start wearing masks. As soon as we had an idea that there was community spread, people needed to start wearing masks because everybody in El Paso should be considered to be positive unless they've been proven otherwise. Now, there was a misunderstanding that someone thought that because I had made a comment about Las Palmas that I'm positive for COVID-19. I'm not. I'm still seeing patients. I haven't had any issues. I have no reason to be tested. Nevertheless, everyone, including myself, should be considered to be positive when you're out and about. And here is where we get into the use of masks. I recommended more than 2 weeks ago that if you're out and about, that you should wear masks. And your children should wear masks. So all of the people that are out and about, that are going to Walmart or going to stores and are taking the whole entourage of family members and children, you're putting those people at risk to get coronavirus if they don't already have it. Now, there is practically impossible to go to the supermarkets and not maintain it's practically impossible to keep a 6-foot distance from anyone. It's usually less than a 6-foot distance, especially if you're going to be congregating around a certain area, like toilet paper, for example, or if you're going to get in line to pay. So if you're at Walmart and you're there with your family members, with your parents, with your children, you are just jeopardizing their health by going there. And I understand that there are a lot of families that only have one parent, and they have to take the children with them. Well, I'm not really speaking in terms of that, but you also have to keep in mind that it doesn't matter anymore. We have had at least one reported child that is positive for coronavirus here in El Paso, and therefore children are not immune from this condition, and therefore they're also probably going to be a lot more children that get sick from coronavirus. So it would be in the best interest of everyone if you have to go out, you use a one-person, one-cart policy in order to reduce the number of potential exposures here in El Paso. If you can't and you have to take your children with you, make sure that they have masks on. I can almost guarantee you that within the next day or so, the president or the CDC is going to reverse its policy on the use of cloth masks, which I've been telling everybody for the past 2 weeks. Wear some type of protection, because we now know that the spread of coronavirus is probably aerosol as well as droplets. And therefore, if you're even within walking distance to someone else, if you can smell someone's perfume or you can smell somebody's bad breath, you are potentially exposed to coronavirus. Bottom line. So why are you taking family members grocery shopping? Why are you going with your children if you can find a babysitter? Find a babysitter and only go out with one person, one cart for the rest of the time that we can figure out exactly how many people are going to be exposed to the virus. And I'm still thinking mid-May. Also, there's been a lot of comments that people are not following the rules as far as having people over their house, and they're still congregating. And obviously, this is completely irresponsible behavior. So, if you need to, call the mayor, call 311, and let's see what happens from there. But it is everyone's civic and social responsibility to make sure that everyone else is following the rules, because this is basically a biohazard situation, biowarfare if you want to call it that. And we're fighting against a virus that doesn't care what age you are, doesn't care what nationality you are, doesn't care where you come from and what your socioeconomic status is. Okay, everybody is susceptible to it, and you should consider that everybody already has it. So please, if you're out and about, start wearing some type of mask, cloth mask. Start maintain the 6-foot distance, one cart per shopper at the stores, and keep your kids at home, because we don't have enough medical services available if the children are going to start getting sick. And unfortunately, where you have sick children, you have the potential that you're going to have children that are dying. And we don't want that to happen. So to answer my question related to cloth masks, start wearing them. You should have started wearing them 2 weeks ago. Start wearing them everywhere. And as far as Mr. Moore is concerned, I do agree with his premise. I'm not sure whether or not the duplication, exponential duplication, is going to happen every 3 to 5 days, maybe 5 to 7 days. But even if it is, we don't have enough tests to confirm that. And so everyone should be assumed to be positive starting 2 weeks ago, but definitely now. My wife doesn't even go out anymore. Okay, I have to go shopping. I go shopping for her and for my son. If we're taking it that seriously, everybody else should. That's your civic responsibility as an El Pasoan. Okay, El Paso strong, El Paso smart. Keep that in mind. Thank you very much. Bye.